Now at 6, the coronavirus continues to spread across the globe and fears continue to grow.
I tell my kids, make sure you wash your hands for at least 20 seconds with warm water or soap. Try not to touch your face.
We found out what's being done to protect Central Florida students and what it would take to close schools if the outbreak gets worse. Tonight, we actually found out that young kids may be the least likely to get the virus. Good evening, I'm Greg Wormuth.
And I'm Martha Sagowski. The governor says that there are now 3 cases of coronavirus in Florida. All 3 are adults in the Tampa area. Health officials are still awaiting test results for 16 others. So far, 24 people have been tested. They tested negative in the state, but 247 people are now being monitored. Channel 9's Lauren Seabrook is joining us live here in the studio with us with the latest from our governor. And Lauren, he's focusing on the elderly population in Florida right now.
Martha, the more cases we see, not just here in Florida, but across the U.S., it is becoming more clear the elderly and those with underlying medical issues are the most at risk, not just of getting the coronavirus, but getting very sick from it. As the number of coronavirus cases in Florida increases to 3, we're learning your children might be in the clear. That's according to a new study published in the New England Journal of Medicine.
In that study, there was not anybody who had tested positive who was 15 or under. Now, that doesn't mean they can't get it, but that suggests that perhaps they're resistant to it if you're younger.
The study focused on the people who tested positive for COVID-19 in China. It also reaffirmed people with underlying medical issues and the elderly are most likely to have severe cases, which prompted Governor Ron DeSantis to take action for Florida's most vulnerable.
So, we've been issuing guidance to the nursing home, community assisted living facilities. You should not be having people entering those facilities who are exhibiting any types of symptoms.
The man in Florida who tested positive for COVID-19 is in his 60s. He originally wasn't tested while in the hospital with pneumonia because his case didn't meet the testing standards. But that changed over the weekend, and now the CDC wants people who come in with lower respiratory issues to be checked.
Bottom line is the guidance has been expanded, and so those individuals who fit the new guidance will be tested, which is a broader net. And obviously that's subject to change as well.
And we have actually heard from several people here in the newsroom who say they were sick, but their doctor wouldn't test them for the virus. So if that is you and you're still sick, you might want to check back with them. Greg.
Good information. Thank you, Lauren. Meantime,